when we talk of the special tests of the knee, there are special tests for the ligaments, special tests for the fluid in the knee, and a special test for menisci. And remember all of them, be it medial collateral ligament, lateral collateral ligament, anterior cruciate ligament, posterior cruciate ligament, all have at least two tests. It is important for all of you to know both the tests. In the examination you have to perform both. Also for the fluid, actually there are three tests. You must know two and competently must perform it on the patient. For menisci also there are two tests. So if you see all the structures that we are going to do the special tests, they have two special tests that we all must know. We will name it. So for anterior cruciate ligament, what is the tests? There are two tests. One is anterior draw test and another is Ligament test. For the posterior cruciate ligament test, again there are two tests. One is sag sign or sag test, and another is posterior draw test. For the medial collateral ligament, again there has to be two tests. One is the valgus stress test with the knee in extension, and another is valgus stress test with the knee in 20 to 30 degree of flexion. For the lateral collateral ligament, it is same. One test is varus stress test with the knee in extension, another is varus stress test with the knee in 20 to 30 degree of flexion. For the menisci, there are again two tests. There can be three, there are three, but two tests you must know which are far more commonly done by the doctors. One is the Magmaris Test, that is far important to know. Another is Thessalis test, and the third one is Apley grinding test. For the fluid in the knee, again there are three tests. The name is patellar tap test, which is far more important. Another is the cross fluctuation test, and the last one is fluid shift test, or the many books are writing Bulge Test. So remember all these structures and the special tests that is meant to detect some abnormality all have two tests that is mandatory for all students to know. First step is bending the knee 90 degree. Next step is I will stabilize it by sitting over the foot. The foot is stabilized. The third step is must ascertain the hamstring is relaxed. You know the hamstring is attached over the tibia, and if hamstring is tight, it won't allow tibia to come forward. And then catch hold of the upper part of the leg, both the thumb anteriorly closer to the joint line, and then you have to pull it. There are two methods of the pulling. You can pull it. It should be a constant forceful pull. Don't make a jerky movement. And the second one is straighten your elbow and then pull it. I will repeat here. I will push it. And I will push it here. This is posterior draw test. Pathological knee. Knee is flexed. Stabilize the foot by sitting over it. Identify the normal side, and this one is the abnormal side. So I am going to do the anterior draw test on the normal side, and I cannot draw it, it is negative. And then I will repeat it by pushing backward is the posterior draw test, it is negative. I will do anterior draw test on the pathological knee, and you can see it is coming up, but it is coming up from the sagged position, from the posterior position, there was a sag sign positive in it, and it is coming up to the neutral position. So this is the neutral position I have brought in, and then I am pulling, it is not coming up. But if I am pushing it back, doing the posterior draw test, it is going back. It means the posterior draw test is positive, not the anterior draw test. One is flex the knee 20 to 30 degree, stabilize the thigh with your another hand, and with my right hand I will be catching hold of the upper part of the leg. Again, I will try to put my finger closer to the joint, and then I will pull it. Should be pull, stabilizing this one and pull. I can do on both sides. This is one. But if patient is bulky, obese, you can put your own thigh behind the knee of the patient, and then you can repeat it. So it becomes easier for you to do it. For the collateral ligaments, always try to do on the normal side. Let us consider right side is a pathological one. We will do on the left side first. So there are again two tests that we have to do. Both we will be doing on both sides. One is, the steps are that lift off the leg from the bed, catch hold of the lower part of the leg, and for the varus stress test must stabilize the medial side and then put a varus force. I am putting the varus force. It should be a sustained force, no jerky movement, and watch for either the movement of the leg medially or joint opening on the lateral side. This is the test when the knee is in extension. Another is flex the knee 20 degree and then repeat it. So again I am doing the varus stress test by applying a varus force and stabilizing the knee from the medial side. I will repeat on the abnormal side, considering the right side is the abnormal one. So first, when the knee is straight, I am doing, so when I am doing the varus stress test, I must stabilize the knee from the medial side, my hand catching hold of the lower part of the leg and making a varus force on it. There is no laxity. I will repeat the same when the knee is flexed 20 degree, and I will do it. So this is the varus stress test. Very, very similar. So on the unaffected side, considering the right side is the pathological one, I will be doing on the normal side first. Here, to test the medial collateral ligament, I have to put the valgus force here. So I will have to stabilize from the lateral side, leg off the bed, my hand catching hold of the lower part of the leg and applying the force, which is the valgus force. And I will watch for the movement if the leg is moving laterally or the joint is opening on the medial side. And sometimes during grade 1 and grade 2 tier, you should look on the face of the patient for any pain. I will do on the abnormal side the same. So it is the valgus force I am applying, catching hold of the leg, the limb is off the bed, the stabilization is on the lateral side, and then putting the force, it is a valgus force, and watching for the movement of the leg which is going laterally or opening the joint. Both are negative here. I will repeat it when the limb is in the 20 to 30 degree flexion and do the same. There is no movement, there is no opening of the joint, and neither there is pain on the face of the patient also. So we'll try the third method, which is very effective and less strenuous. Ask the patient to come on the edge of the table, knee on the edge of the table, where you can flex it, extend it, and then you apply on the lateral side. I am applying the knee extended and doing the valgus stress test. Same way I can do it the varus stress test. See it like this also. Varus stress test, valgus stress test. Flex it 20 degree, valgus stress test. Then varus stress test. Take out the patient's leg with the help of your arm and forearm. You can do the same. I am doing it. So this is the valgus stress test when the knee is extended, and this is varus stress test when the knee is extended. I can repeat when the knee is flexed, the same. It is easy now. One is the patellar tap test, another is the cross fluctuation test, and the third one is the bulge test, or also it is called fluid shift test. So let us do one by one. So I am demonstrating now the patellar tap test. Patellar tap test is that you have to milk the fluid from the suprapatellar bursa to the patellofemoral compartment. And that is what I am doing now. So we know the suprapatellar bursa extends 4 finger breadths superior to the superior pole of the patella, a little up. I will start and see this all around. I will be pressing and not allow the fluid to go back again. So I will keep the pressure on. I am milking the suprapatellar bursa so that the fluid goes in the patellofemoral compartment, and once it goes in the patellofemoral compartment, the patella will be shifted away from the femoral condyle. That is our purpose. And many of the authors, they do say that push the patella a little downward, and then you push the patella so that it goes and hits the femoral condyle. So it is like this. It may be by 3 fingers, maybe by 4 fingers, 5 fingers, does not matter at all. You can do with any number of fingers. Idea is that the patella should go and hit the femoral condyle, and the hitting and the rebound phenomenon that you perceive with your hands, this is called patellar tap test. The second one is the cross fluctuation. You have to do the same. I have already done the milking of the suprapatellar pouch. Then keep the 2 fingers quite away, and when I will be pushing the fluid with these 2 fingers, I will perceive the thrust of the fluid with these 2 fingers. So it will be here, and when I will push the fluid from here, I will perceive the fluid here. So it will be something like this. It can be elevated also if there is a fluid. So this is called cross fluctuation test that usually you do in a cystic swelling. The third one is fluid shift test. Milking of the suprapatellar pouch is to be done, already done by me. And then what you do is you remove the fluid from one compartment. So I am removing the fluid from one compartment, and then when you push it again from the other compartment, you can see the fluid refilling in that compartment which you have just emptied, or can see a fluid bulge as well. This is called fluid shift test or bulge test. For the Magmaris test, there are certain criteria. One is the step 1 I am going. So step 1 is the knee should be fully flexed. Preferably, the heel should touch the buttock. Now from here, we have two options. One is, let us demonstrate for the meniscal tear of the medial side or medial meniscus. For the medial meniscus, full flexion of the knee, heel touching the buttock. Your hands should be over the knee and fingers over the joint line preferably. So this is joint line. Third step, external rotation of the tibia over the femur. Can you see this external rotation? So knee fully flexed, heel almost touching the buttock. For the medial meniscus, there will be external rotation that you will be doing. So see the external rotation of the tibia over the femur. And then two fingers over the joint lines, and then I will extend with a little of valgus force.